Have you checked your mailbox lately? Because one letter could arrive without warning and affect benefits that many Americans depend on every single month. Most people assume that once Social Security benefits begin, everything continues automatically. They believe the paperwork is finished, the approval process is over, and there is nothing left to worry about. But for some beneficiaries, especially those receiving disability-related benefits, that assumption can lead to serious problems. At the same time, millions of Medicare recipients are unknowingly missing healthcare services that are already covered, already available, and already paid for through the program they use every year. The surprising reality is that many people lose opportunities not because they are unavailable, but because nobody clearly explained how these programs work. Today, we're going to break down what every beneficiary should know about Social Security medical reviews, why certain notices deserve immediate attention, and why one Medicare benefit that costs absolutely nothing could provide information that protects your health for years to come. When people hear the words medical review, they often assume the worst. Some fear that their benefits are about to disappear. Others believe that receiving a notice means a decision has already been made against them. Fortunately, that is not usually the case. Understanding the purpose of these reviews is the first step toward reducing unnecessary anxiety. The Social Security Administration periodically conducts evaluations known as continuing disability reviews, commonly referred to as CDRs. These reviews are designed to determine whether individuals receiving disability benefits continue to meet the medical requirements of the program. The review process exists because medical conditions can change over time. Some people improve, others remain stable, some conditions become more severe. The agency periodically reviews cases to ensure benefits continue according to program rules. One of the most important facts beneficiaries should understand is that these reviews generally apply to disability programs rather than retirement benefits. If you are receiving Social Security retirement benefits because you reached retirement age, these disability-related medical reviews typically do not affect your monthly payments. However, if you receive SSDI, SSI based on disability, or have a family member who does, understanding how reviews work becomes extremely important. Recent administrative changes have increased attention on disability case processing. Efforts to address backlogs and improve efficiency mean that more reviews may move through the system than in previous years. For beneficiaries who have not undergone a review in a long time, this means there is a greater chance that updated information could eventually be requested. Receiving a review notice should not immediately cause panic. A review notice is generally a request for information, not an automatic termination of benefits. The agency may ask about your medical treatment, healthcare providers, medications, work activity, or changes in your condition. The goal is to gather current information before making any determination. The way beneficiaries respond to these requests can make a significant difference. Medical records are often one of the most important pieces of evidence available during a review. Doctor visits, treatment notes, prescriptions, specialist reports, therapy records, laboratory results, imaging studies, and hospital documentation help create a complete picture of a person's condition. Imagine trying to explain several years of health challenges without any records. It would be difficult. Medical documentation tells the story in a way that memories alone cannot. Each appointment adds another chapter. Together, those records demonstrate ongoing treatment, symptoms, and the impact a condition continues to have on daily life. This is why many professionals encourage beneficiaries to maintain consistent health care whenever possible. Some individuals stop seeing providers because they feel their condition has not changed. Others face transportation problems, financial difficulties, scheduling issues, or provider shortages. While these challenges are understandable, long gaps in treatment can sometimes make it harder to document ongoing limitations when a review occurs. The central question in many disability reviews is straightforward. Has the medical condition improved enough to affect eligibility? Current medical records help answer that question. Without documentation, assumptions can become more difficult to challenge. Another issue that deserves attention is timing. Government correspondence often contains deadlines, and missing those deadlines can create avoidable complications. Many people underestimate how quickly days pass after receiving official notices. A letter arrives on Monday. It sits unopened for several days. The recipient plans to review it over the weekend. Then another week passes. Before long, valuable response time has disappeared. Creating simple organizational habits can help prevent these situations. Keep important paperwork together. Save copies of notices. Maintain records in a safe place. Open official correspondence promptly. Review deadlines carefully. These small actions may seem insignificant in the moment, but they can make an enormous difference later. Family members and caregivers can also provide valuable support. Many beneficiaries rely on spouses, adult children, relatives, or trusted friends to help manage appointments, paperwork, and healthcare decisions. Having another person aware of important notices can reduce the likelihood that critical information is overlooked. Review schedules are not identical for every beneficiary. Some conditions are expected to improve and may be reviewed more frequently. Others are considered stable or unlikely to improve and may be reviewed less often. Because each case is unique, comparing your situation to someone else's may not provide useful guidance. The most effective approach is staying informed about your own circumstances and responding appropriately when information is requested. Knowledge reduces uncertainty. Preparation reduces stress, and both can make the review process easier to navigate. Now let's shift to a topic that affects an even larger group of people. Millions of Medicare beneficiaries are missing a healthcare service that is already available to them every year at no additional cost. The surprising part is not that the service exists. The surprising part is how many people never use it. Many Americans approach healthcare in a reactive way. They visit a doctor when something hurts. They schedule appointments when symptoms become noticeable. They seek treatment after problems appear. Preventive healthcare follows a different philosophy. Instead of waiting for health concerns to become obvious, preventive care focuses on identifying risks before serious problems develop. This approach matters because many conditions progress quietly. High blood pressure may have no obvious symptoms. Blood sugar levels can rise gradually. Balance problems can develop over time. Memory concerns may begin long before family members notice them. When issues are identified early, people often have more options available to them. That is why preventive healthcare has become such an important part of Medicare. One of the most valuable preventive services available is the Medicare annual wellness visit. Despite being available for years, many beneficiaries have never scheduled one. Some assume it costs extra. Others believe it is the same as a traditional physical examination. Many simply do not know it exists. As a result, they miss opportunities to receive important information about their health. Unlike a traditional physical exam, the wellness visit focuses on prevention and long-term planning. Healthcare providers review medical history, medications, risk factors, family history, and overall health concerns. The goal is to create a personalized prevention strategy tailored to the individual. The visit often includes discussions about lifestyle, daily functioning, and factors that could affect future health outcomes. One area receiving increasing attention during these appointments is cognitive health. Memory and thinking abilities influence nearly every aspect of daily life. Yet many people rarely discuss cognitive health with healthcare providers until significant concerns appear. That is exactly why preventive evaluations have become so valuable. Many cognitive changes develop gradually. Early signs may be subtle enough that individuals dismiss them as normal aging. Occasional forgetfulness, difficulty concentrating, or minor changes in decision-making can easily go unnoticed. However, healthcare providers understand that early awareness creates opportunities. When concerns are identified sooner rather than later, individuals and families have more time to ask questions, explore resources, and make informed decisions, and that is only one of several important areas addressed during preventive healthcare visits. One of the biggest advantages of preventive healthcare is that it focuses on identifying risks before they become serious problems. Too often, people wait until symptoms interfere with their daily lives before seeking medical attention. By that point, conditions may be more difficult to manage. Preventive services are designed to help change that pattern by encouraging regular evaluations and early awareness. Cognitive health is a perfect example. Many people assume memory issues happen suddenly, but healthcare professionals know that cognitive changes often develop gradually over months or even years. Small signs may appear long before major concerns become noticeable. Someone may forget appointments more frequently, struggle to remember recent conversations, misplace items more often, or find it harder to concentrate on familiar tasks. Individually, these situations may not seem significant. Collectively, they can provide valuable information about a person's overall cognitive health. The purpose of cognitive screening is not to create fear. It is not intended to diagnose serious conditions during a single appointment. Instead, it serves as an opportunity to evaluate memory, attention, reasoning, and other mental functions in a simple and non-threatening way. Early awareness can be extremely valuable. When concerns are identified early, individuals have more time to consult healthcare professionals, discuss treatment options, explore supportive resources, and involve family members in important decisions if necessary. Even when no concerns are found, the screening can provide reassurance and establish a useful baseline for future comparisons. Another area that receives significant attention during preventive healthcare visits is fall risk. Falls remain one of the most common causes of injury among older adults. Unfortunately, many people do not think about fall prevention until after an accident occurs. A single fall can lead to fractures, hospitalization, rehabilitation, reduced mobility, and loss of independence. What makes this issue especially important is that many fall risks can be identified before an accident happens. Healthcare providers often evaluate balance, walking ability, medications, vision concerns, muscle strength, and everyday activities. Sometimes small changes can dramatically improve safety. Better lighting, removing tripping hazards, using supportive footwear, participating in balance exercises, reviewing medications with a healthcare provider. These simple adjustments can reduce risk and help maintain independence for years to come. Mental and emotional well-being also play a major role in overall health. Many older adults experience loneliness, stress, anxiety, or depression at some point. Unfortunately, emotional health concerns often go unaddressed because people hesitate to discuss them. Some assume feeling isolated or discouraged is simply part of aging. Healthcare professionals recognize that emotional well-being affects physical health in many ways. It can influence sleep quality, energy levels, motivation, appetite, relationships, daily functioning. By including discussions about emotional health in preventive care, healthcare providers can identify concerns that might otherwise remain hidden. Sometimes a simple conversation opens the door to support and resources that significantly improve quality of life. Beyond the wellness visit itself, Medicare beneficiaries may also have access to various preventive screenings that many people never fully utilize. Cardiovascular screenings help evaluate risk factors related to heart health. Heart disease continues to affect millions of Americans, making early awareness especially important. Monitoring certain health indicators, can help individuals and healthcare providers make informed decisions regarding prevention and treatment. Diabetes screening represents another important preventive tool. Many people live with elevated blood sugar levels without realizing it. Because symptoms can develop gradually, individuals may remain unaware of potential concerns for years. Early detection creates opportunities for lifestyle adjustments and medical guidance that may help reduce future complications. Cancer screenings also remain a critical component of preventive healthcare. Different screenings apply to different people depending on age, risk factors, family history, and medical recommendations. The common goal is simple: identifying concerns as early as possible. Early detection often provides more options. More options can lead to better outcomes. That is why healthcare professionals continue to emphasize the importance of appropriate screening schedules. Bone health is another area that deserves attention. As people age, changes in bone density can increase the risk of fractures and mobility limitations. Preventive evaluations help identify concerns before injuries occur. Understanding bone health allows individuals to discuss preventive measures with healthcare providers and make informed decisions about maintaining strength and mobility. Vaccinations represent another preventive service that many beneficiaries overlook. Some people assume vaccinations are only important during childhood. Others believe they no longer need them because they have remained healthy for many years. Healthcare recommendations evolve throughout life because health risks change over time. Protection against illnesses such as influenza, pneumonia, shingles, and certain respiratory infections can be particularly important for older adults. Staying informed about recommended vaccines helps individuals make decisions that support long-term health and reduce the risk of preventable illness. One of the most important lessons beneficiaries can take away from all of this is the value of asking questions. Many people assume healthcare providers will automatically discuss every available service. While providers work hard to educate patients, healthcare appointments are often limited by time. Asking questions helps ensure important topics are not overlooked. What preventive services are available? Which screenings apply to my situation? What health risks should I be monitoring? What steps can I take to support my long-term health? These conversations empower individuals to become active participants in their healthcare. Recent changes aimed at expanding healthcare access have also made certain services more convenient for many Americans. Convenience matters because people are more likely to utilize services when access is easier. This is especially true in rural communities where transportation challenges and provider shortages can create barriers to care. Expanding access points helps more individuals receive timely evaluations and testing when needed. The easier healthcare becomes to access, the more likely people are to participate in preventive care, and the more people participate in preventive care, the greater the opportunity to identify concerns before they become serious. When we look at the broader picture, an important theme emerges. Social Security disability reviews and Medicare preventive health care may seem like completely separate topics. One involves benefit eligibility. The other focuses on health and wellness. Yet both depend on the same fundamental principle: awareness. People who understand how these systems work are often better prepared to protect themselves. A disability beneficiary who understands review requirements is more likely to maintain records, respond promptly to notices, and avoid preventable complications. A Medicare beneficiary who understands preventive healthcare opportunities is more likely to schedule appointments, complete screenings, and gain valuable insights about their health. Information creates opportunities. Preparation creates confidence, and both can help people make better decisions. Every year, countless individuals miss valuable benefits simply because they never learn about them. They do not ignore opportunities intentionally. They are often unaware those opportunities exist. That is why staying informed matters so much. Open official correspondence promptly. Keep important documents organized. Maintain communication with healthcare providers. Pay attention to deadlines. Ask questions when something is unclear. These habits may seem simple, but their impact can be significant. For disability beneficiaries, maintaining current medical records and staying engaged in treatment can make future reviews easier to navigate. For Medicare beneficiaries, understanding preventive healthcare benefits can provide valuable information about current health and potential future risks. Neither approach requires specialized knowledge. Neither requires complicated planning. Both begin with awareness and action. The people who benefit most from these programs are often not those with the greatest resources. They are the individuals who remain informed, organized, and proactive. A single letter can contain information that deserves immediate attention. A single appointment can identify a concern before it becomes serious. A single conversation with a healthcare professional can lead to decisions that improve quality of life for years to come. That is why understanding these programs is so important. Not because every person will experience the same challenges, not because every beneficiary will need every available service, but because everyone deserves the opportunity to make informed decisions about their benefits, healthcare, and future. If you receive disability benefits, stay attentive to official notices and maintain current records whenever possible. If you are enrolled in Medicare, take time to learn about the preventive services available to you and discuss them with your healthcare provider. The benefits are already there. The opportunities already exist. The most important step is knowing about them and taking advantage of them when appropriate. Share this information with friends, family members, caregivers, and anyone who may benefit from understanding these programs. Sometimes a simple conversation can help someone avoid a costly mistake, discover an important resource, or take a meaningful step toward protecting both their financial security and overall health. USA Retirement Guide.